Hi, Benny. Benny is here to have his oral haematoma drained. Hey, aren't you, buddy? Look at that gorgeous face. Alright, so Benny's asleep under the anaesthetic. This is his oral haematoma. You can see what has happened is he's ruptured a blood vessel in the pinna in the ear here, and then it's swelled up with blood. The reason that Benny ruptured a blood vessel in his ear is that he had an underlying ear infection and he had been shaking his head. Benny hasn't suffered from ear infections before. This is the first one that he's got, and he's been really unlucky that he just managed to shake his head with enough force that he's ruptured those blood vessels in his ear. So from this point forward, you'll see that first I need to clean his ear out. I've already performed ear cytology before this point, at the consult the day before, and discovered that he had a yeast infection in his ear. So it's really important that we clean out his ear and start treating the ear infection with topical ear meds. So the first step is doing a bit of an ear flush and then checking that I have removed all the debris from his ear. There are two main ways of treating oral haematomas. One is with surgery, where we make an incision, we drain out the blood that is collected in the ear, and then we stitch the two pieces of ear cartilage together. And that may be with just plain stitches, it might be using stents or even some special foam to hold the ear together. The second way is what we've chosen to treat Benny with, and it's where we're going to drain the blood out of his ear and inject a long-acting steroid back into the space between the two pieces of ear cartilage. There were a couple of reasons behind the decision to go for the drain and injection method for Benny. Benny resents his ears being touched. It induces quite a bit of anxiety for him, and it does trigger even further shaking. So there was the risk that if we went with the surgical method and placed sutures in his ear, that would then have him shaking his head further and risk him rupturing the blood vessels in his other ear as well. And I felt that it was very likely that it would make it harder for us to be able to treat his ear infection. I spoke at length with his parents, and they are well aware of the fact that there is a high chance that the blood may refill in his ear and that we will have to repeat the whole procedure again in 7 to 10 days. During the ear flush, I used an otoscope to examine down further into the horizontal ear canal, and a small soft urinary catheter to suck out any additional discharge that is building up near the tympanic membrane. I repeat this until all I am getting back is the clear saline that I am putting into his ear, and then we're ready to perform the procedure. As with any sterile procedure, I have Nurse Natalia sterilely prep the area. So she's clipping the hair away, she cleans it, and then she does a final surgical prep with a combination of metho and chlorhexidine. Meanwhile, I am getting some sterile surgical gloves prepared and some fresh sterile needles and the medication required that I will be injecting back into the ear flap after I've drained the blood out. Using a large gauge needle, I aspirate the blood from between the two flaps of cartilage. I have Natalia take a picture for me to show you guys what it looks like, because I'm aware of the fact the light is not making this look very clear for you. I end up removing all up nearly 10 mils of blood from his ear, and then I'm able to inject the long-acting steroid after the blood has been removed. I make a point of not removing the needle, but leaving the needle in place and then removing the syringe from it. This is to reduce the trauma that I create between the flaps of cartilage in the ear, and also to ensure that I am in the right plane of tissue when it comes to me injecting the steroid back in. For the duration of Benny's anaesthetic, Natalia is monitoring Benny's vital signs and recording the findings in our SmartFlow anaesthetic monitoring chart on the iPad there. I am now ready to inject the steroid into the ear. I will massage it around once it's injected in there to ensure there's an even coating, and then we will place a light pressure bandage which will temporarily keep his ear held flat against his neck for the next hour whilst he is recovering from the anaesthetic. Here I am applying the first lot of antifungal ear ointment to clear up his ear infection, and then Natalia is placing the temporary bandage to hold his ear flat against his neck. So Benny recovered really well from his anaesthetic, and this is a post-op picture of him. So I thought in summary I'd show you his before photo of his swollen oral haematoma, the draining of the fluid from the haematoma, and then what his ear looked like post-operatively. I've also got a quick catch-up to show you of how Benny's doing now. Here you go, so this is Benny's first post-op check. His ear's swollen up a little bit, but it's pretty good. So we'll see how it goes over the next few days.